Hi everyone, this is Harshita. Welcome to Teddy Gates You channel. So today we are going to discuss an important topic called bronchial asthma. It is a very important topic which comes under the obstructive lung diseases. In the previous classes I discussed about the emphysema and the chronic bronchitis in a very easy manner. If you didn't see the video, please go back and see the video first. Okay, let's start the video. Chronic bronchitis. Okay, let's start the class. And the definition of the bronchial asthma is due to any kind of reversible bronchoconstriction or inflammation of airways, there will be hyper responsiveness. Okay, because of this hyper responsiveness, we will get bronchial asthma. As it is hyper responsiveness, we can say that this is type 1 hypersensitivity reaction. So this is type 1 hypersensitivity reaction, and the most important genetic components are 3. Okay, please do remember these all. So first one is there is atrophy in the gene which is present in the chromosome 5. So this chromosome 5 is very important. Gene for atrophy is on chromosome 5, and polymorphism in interleukin 13 and ADAM 33 gene matrix metalloproteases. Okay, and the third one is as the severity of the bronchial asthma increases, there will be increased association of VKL40. Okay, so these three are very important first. Okay, and come now let's see the pathology. In this pathology we see CQ, means we see three kinds of bodies which starts with C. First one is Crushman spirals, second one is Charcot-Leyden crystals, and third one is Crayola bodies. Okay, first one is Crushman spirals. Spirals name itself says that something is in spiral shape. What is in spiral shape? At present we are discussing about the respiratory system. In respiratory system we always come across the word called mucus. So there is world appearance of mucus plugs. Like mucus is arranged in a kind of circular shape. These are called as Crushman spirals. Next one is Charcot-Leyden crystals. They are nothing but the eosinophilic membrane proteins. These eosinophilic membrane proteins are called as galectin 10. Do remember like this. Crystals are something like solids. These solids are nothing but the proteins. So what is this protein? This protein is galectin 10 protein. Okay. This is nothing but the eosinophilic membrane protein. And the next one is Crayola bodies. These Crayola bodies are nothing but the slogged mucous epithelium. Epithelium is filled with the mucus. This is the appearance of Crayola bodies. So please do remember this. In pathology you get to know. In pathology of the bronchial asthma, okay, you will observe 3 C's. Okay, now let's compare the histology of a normal lung and the lung that is affected with the bronchial asthma. Okay, by seeing these two pictures you can understand everything. For example, this is the mucus lining. Okay, this is the mucus lining. Please do observe the mucus lining in both the images. It is very thin and here it is very thick. Next one is epithelium. In epithelium, you can see the difference of goblet cells. In the normal, we are having minimum goblet cells. In this bronchial asthma, we are having more number of goblet cells. And the basement membrane. Thickening of the basement membrane will increases. And lamina propria. In the lamina propria, we can observe mast cells, neutrophils, macrophages and eosinophils. These are all the cells that we observe in the inflammation. So all the inflammatory cells will come and occupy in the lamina propria, and then we can observe there is increase in the smooth muscles. Here there is only one layer of smooth muscle, but here there are many layers of smooth muscles. And if you come down, we can observe the increase in the number of glands. Okay, this is cartilage. And here we can observe number of glands increases in the bronchial asthma. So if you come to a finalization, so altogether this process is called as airway modeling, like the airway is getting modified or modifying itself. Okay, how it is modifying? There is increase in the mucus production. So mucus production should be increased. How? Due to the hyperplasia, like goblet cells are undergoing division. Because of the division, there is increase in the mucus production. As the goblet cells are increasing, to bear that goblet cells, thickening of the basement membrane is also increases. To bear the goblet cells, thickening of the basement membrane is getting increased. And in the lamina propria, we can see inflammatory cells. Inflammatory cells are nothing but the mast cells, neutrophils, macrophages and eosinophils. And there will be smooth muscle hypertrophy. To bear, remember like this, to bear all the inflammatory cells in the lamina propria, the smooth muscle is getting hypertrophy, like the size of the muscle is getting increased. And next one is submucosal gland hypertrophy or hyperplasia. The glands present in the submucosa are getting increased or getting divided so that it is suitable for exchange of gases. So these are all the histological changes that we observe in the bronchial asthma patient. Okay. I hope you like the class. If you not yet subscribed to the channel, please do subscribe to the channel to educate you. This is K. Harshita signing off. Thank you so much.